this is a 42-year-old male complaining of pain in the right Achilles tendon going on for about a year. There was no injury. His pain is mostly about maybe an inch or two, more like an inch proximal to the insertion, where the ultrasound does demonstrate some tendinosis. More of an incidental finding is what looks like an accessory soleus muscle. So we're going to just look at that. We already have a couple of images. It's basically kind of not completely obliterating, but you can see it in the medial aspect of Kager's fat.
Here we're going to go through anatomy of an accessory soleus muscle. Here there is just normal anatomy. You can appreciate the Achilles tendon and the underlying Kager's fat pad. Also you can appreciate the anatomy of the lateral ankle with the peroneal tendons and the lateral musculature on the plantar aspect of the foot. Here we are posteriorly now and rotating medially. You can appreciate the posterior tibial artery and the tibial nerve. Also you can appreciate parts of the deltoid ligament as well as the adductor hallucis muscle, as well as the tibialis posterior tendon and flexor digitorum longus tendons. Here we're adding this accessory soleus muscle. Based on the ultrasound, it appears to be on the medial aspect of the Achilles tendon, and it appears to insert into the Achilles tendon itself on its underbelly. We are rotating laterally now, and we're making the Achilles tendon translucent, and now we're getting rid of the Achilles tendon. You can see the remaining plantaris tendon, and here's a clearer view of the accessory soleus muscle and how it relates to Kager's fat pad. Here we're just isolating the gastrocnemius muscles and the soleus muscle and this accessory soleus muscle as well, and here we can see its relationship to Kager's fat pad, again on the underbelly of the Achilles tendon. Here you can appreciate plantaris tendon medial. Now we're rotating and making the Achilles translucent.
The Achilles were at 1139. We can see kind of moderate tendinosis.
Here you can see moderate thickening of the distal Achilles, and the very posterior aspect you can see that tendinosis. Here we're looking at Kager's fat. Do not see any retrocalcaneal bursitis within the Kager's fat pad.
What's more interesting is when you look at this in a short axis view, the tendon, and he has a little bit of like an intrasubstance tear or cyst within the distal Achilles on kind of that anterior belly. Looks like an accessory soleus. Look at the left side of the screen. He has muscle kind of pushing up on the underbelly of the Achilles tendon on the medial aspect of the tendon. You can see it's just pushing in, kind of almost making that underbelly concave from that accessory soleus. At 1141, we can see basically there's only soleus muscle underneath the tendon. So we're at 1141. All soleus muscle. Keep going distally. And now we can see where there's muscle on the medial aspect of the tendon, and then Kager's fat on that lateral aspect. And we're just going to show it again. So here we are distally. You don't really see the muscle here, but then it starts right there, 1142. Just going up.